Breaking medical news. The national Cyclosporiasis case count has officially climbed past 7,000. This is a massive public health emergency. Federal surveillance data indicates several concurrent outbreaks, but one major cluster is tied to shredded iceberg lettuce distributed by Taylor Farms de Mexico. As of mid-July, the CDC reported over 1,600 confirmed illnesses specifically linked to Taco Bell locations across 5 states. 94 people have been hospitalized. But here's the problem. The actual number is likely much higher. Surveillance often lags behind the true scope of an outbreak. It can take up to 6 weeks to link a patient to a specific outbreak, and many mild cases go completely undiagnosed. There is also a gap between state tallies and national data. The CDC only counts laboratory-confirmed cases, while states often report probable illnesses. Traceback investigations point to a single supplier, Taylor Farms de Mexico. The contamination hit locations in Indiana, Kentucky, Michigan, Ohio, and West Virginia. Taylor Farms initiated a voluntary recall of all iceberg lettuce sourced from central Mexico, and Taco Bell has ceased using the implicated product. Interestingly, an earlier positive sample was reclassified as a false positive, but the investigation continues to follow the supply chain. Now, let's talk science. What exactly is Cyclospora cayetanensis, and how does it wreak havoc on the human body? It is a microscopic parasite. Transmission occurs through fecal contamination of food or water, most often linked to fresh produce imported during warm months. When contaminated water is used on crops, these parasites hitch a ride directly into our food supply. Infection causes prolonged, watery diarrhea that can last for weeks without treatment. It is debilitating. You'll see intense fatigue, loss of appetite, bloating, and low-grade fever. Interestingly, vomiting is actually uncommon with this parasite. Symptoms typically begin about a week after exposure, but can take up to 2 weeks to appear, making it extremely difficult to trace. Diagnosis is another hurdle. Routine stool tests, the standard ova and parasite panels, often miss this organism entirely. You need a test specifically designed for Cyclospora. If you have relapsing diarrhea, you must ask your clinician for this specific test. Once confirmed, the treatment of choice is trimethoprim sulfamethoxazole, commonly known as Bactrim. Beyond antibiotics, hydration is central to management. These patients lose an immense amount of fluid. For hospitalized patients, intravenous fluids are often necessary to combat the severe dehydration caused by the parasite. The problem with bagged lettuce is the false sense of security. It says washed, but in an outbreak like this, you cannot be certain. My advice? Buy whole heads of lettuce whenever possible. Take them home and wash them thoroughly yourself. Mechanical washing is your best defense. If you're eating out, don't be afraid to ask how the lettuce was prepared. Until this outbreak is fully contained, I recommend avoiding shredded iceberg lettuce at restaurants in the affected 5 states. This year's national case count is running notably higher than recent seasons. We are seeing a typical seasonal rise, but with a dangerous intensity. Stay informed, stay vigilant, and protect your family by following these simple food safety steps. At Medicine Made Easy, we bring you the facts you need to stay healthy in an increasingly complex world. I'm Dr. Gnoni. If you found this briefing helpful, like this video and subscribe to our channel for more infectious disease updates. Don't let a simple salad turn into a weeks-long medical battle. Wash your produce and stay safe. We'll see you in the next round. Stay healthy, everyone.